What can you tell us about RSI among, people who do manual therapy and massage therapists?
Yeah, absolutely. Thank you for having me. The biggest thing that I can say around this is that it is the number one reason for people to either miss work in practice or to actually have to retire from practice is the cumulative effect of repetitive strain injuries. So especially one of the biggest things that we talk about during some of our seminars are biomechanics and ways to save your body. I used to do a lot of active release technique myself, where I would push with my thumb on different muscle and tight points and then move patients around and make sure that they had good mobility and flexibility. Even learn from me is what I'm trying to say here. I have aching in my interphalangeal joints of my thumbs bilaterally. There's a article by Snodgrass, I think it was 2002, 2003. 91% of physical therapists have had to miss work because of thumb pain. All right, so
I was saying that the thumb, I was going to actually ask you about that because so many of them are just, especially people who do deep tissue massage.
Oh, yeah, absolutely. So you're looking for ways that you can save your hands. And ultimately, people always talk about what are the weight-bearing joints of your body, the parts that are designed to carry weight. Well, those are your hips, your low back, your knees. But the problem is, what do we do as manual therapists is we wind up using these non-weight-bearing joints to carry weight day in and day out, and it gets very hard on the joints. So one of the best things that you can do is find alternate ways to offer therapies for patients that don't cause so much trauma to your hands. And it is literally repetitive stress trauma is what's happening.
Well, maybe we should just jump right in and talk about instrument-assisted soft tissue mobilization at this juncture, because anyone who's watching, I interviewed Dr. Vizniak about iStem,
Yep.
Which uses instruments instead of the hand, and it's a good thing.
It is a good thing. There are literally hundreds of different devices. Some of these have been around for, well, some are bone, some are stone that have been around for literally thousands of years because people realized a long time ago that you require modification in what you're doing. For myself, what do I typically use is I still use a lot of manual hands-on therapy for patients, but I wind up using instruments like this that literally, this now is the shape of my thumb. So I can push through the heel of my hand and not have to put weight onto these rather expensive fingers, I might add, with all the time that was invested on them as well, right? That's the shape of my knuckle right there. And then other shapes that you see, like different blade shapes, wind up working and fitting different areas of the body fairly well as well. And if you look at it, the force I can generate with my hand is that much. And if I use an instrument, I'm about 36 times more specific with this edge than with my hand. So it means every time I work on somebody, the dose is that much higher and that much less on my body. So I become more efficient with every treatment.
What about the posture? Because it seems to me that you would be able to use a neutral handshake position rather than a pronated position at some junctures if you're using the right tool.
Well,
am I right?
I mean, yeah, absolutely right. And there's a couple of things that we can even change on that a little bit. Number one is using your body weight whenever you can. So if you can stand over top of somebody and push down where it's literally just body weight, you're going to have better biomechanical advantage. The next thing is exactly what you said, Deborah. If you can have neutral wrists when you treat, things are going to be way better. We're writing a book now, just finishing it up on massage therapy for massage therapists. And one of the key things that you see out there for a lot of them is they're treating like this with the ultra high shoulders and a lot of muscle tension. Your goal is to relax and be nice and neutral as you're starting to do your therapy. And it actually works better for the patient because the more relaxed you are as the clinician, that goes forward to the patient that you're going to be treating, right? The next thing is going to be, exactly like you said, whenever I can have a neutral wrist position, things are going to be easier. And I can generate a lot of force with simple positions like this, with simple movements like this, where it's not actually my hand generating the force, but I'm using biomechanical tool advantages to do that.
I knew a massage therapist, and she was in serious problems with her shoulder. It was very tight, very sore. I knew another massage therapist who was doing reflexology, and both of them had to find different careers because it's just really, I mean, I'm not sure about the first one finding a different career, but it was difficult. And sometimes I think also if you're working at a spa or something, you're expected to see one patient after another, so you don't have any recovery time. So what could someone conceivably do to protect themselves? I mean, maybe they could go along and see 5 patients as long as they're not back to back. You know what I mean?
It's good that you bring that up. What I actually specialize in my practice is I'm the doctor and therapist who treats the other doctors and therapists. About half of my practice is other healthcare providers. So when they come in, they're looking for advice and strategies that I can give. One of the biggest ones is not overloading. It goes back to the key theme of the repetitive strain injuries here, is exactly that. Yes, you might have to go through 5 patients in one sitting, but find ways that you can be more gentle to start with. Start off using a forearm, start off using an elbow, and then gradually working your way to more specific contacts. But on areas of the body that are really hard to work on, things like the plantar fascia, the iliotibial band, even these suboccipital muscles, I can remember as a student first learning, having treated patients, and you pull back on the suboccipital muscles, and afterwards you can't even hold a pen to fill out your chart notes or anything like this. You need to use shapes that will save your hands and start to sink into those areas, and limit your time on it. Again, this is going to be way more force than I can generate with my own thumb and way more specific. So it's a way that you can see more efficiency and potentially better results with your clientele.
And you could mix iStem with other.
100%. You should be, everything you're doing, like people always think, well, you can only use one treatment method. Absolutely not. What you should be doing is hands are out, get that one-on-one contact. When the heavy lifting happens, that's when you bring out special instruments, back to hands, and it's a dance back and forth with fluid movements returning back and forth between those actions. And at the end of the day, people do feel it. Like at the end of a full clinic shift, a lot of people will say, yeah, my wrists hurt, yeah, my shoulders hurt. Then there has to be something you need to change in that daily routine right there.
And, you know, it's funny what you said earlier about things being around for thousands of years, because I think that iStem started with some tools from China or Japan or someplace, and it eventually people caught on. But I have some very old textbooks on repetitive strain injury, and believe me, the scribes knew about focal dystonia.
Yep.
And there's a picture that I use in my slideshow from the New York Public Library, and this person has the most beautiful penhold you've ever seen, this monk. And they also tilted things up in a very ergonomically friendly way so that they're using their shoulder, they're using their body, they could shift from weight to weight, from sitting bone to sitting bone, to use their entire body the way a good pianist will shift, rather than reaching.
Absolutely. You're absolutely right. And the biggest thing is postures aren't bad for you. It's long held postures that cause pathology. Long held postures cause pathology. That's what you need to get. So if you change positions, move the body lightly like it was designed to move, sometimes heavy movements, usually light movements, things are going to go way better for you.
Well said. Well, thank you so much for coming on the show, Dr. Vizniak. I'm sure that our massage and manual therapists are going to be very enlightened by what you're saying, and will heed the word to not hold postures for too long.
Yep.
Thanks everybody for.
They can find me. If anybody has any questions, they can find me at prohealthsys.com, or they can go ahead and follow me on Instagram or Facebook. No problem.
And they can study with you as well, right?
Absolutely,
you have a training program for iStem.
Yep, we have online courses as well, so lots of availability beyond our textbooks that we read.
Terrific. Thank you for sharing that. And thanks everybody for watching RSI Help YouTube. We'll be back with another exciting episode with Dr. Vizniak soon. Thank you so much, and please subscribe.